how do you practice yoga without stirring up your flares and triggers and without suffering for the consequences later on? I'm going to share 5 tips on how to practice yoga when you have chronic pain without suffering for the consequences later. And you know what I'm talking about if you have chronic pain and you've heard the advice of going to yoga classes, but you tried it out and didn't feel like the class itself was approachable, friendly, or safe for your body. So follow along with this video for my next 5 tips. Hi everyone, my name is Elaine Ouyang. I am a certified yoga therapist, bringing you yoga therapy practices and pain care strategies to help you dial down your pain. Now, before we get started today, I'd love to invite you to download my free Pain Care Yoga Starter Toolkit, which you can find on my website at elaineyoga.com. My first tip for practicing yoga when you have chronic pain is to definitely find a right teacher. And this is really important because most yoga teachers nowadays that you find in gyms and yoga studios, they're not quite so well trained enough to work with specific medical conditions. So you might want to consider finding yourself a private yoga teacher or even a yoga therapist who are more well equipped and trained to work with medical conditions and even in clinical settings. If you have a trusted chiropractor, acupuncturist, massage therapist, you can ask them to see if they know of any private yoga teacher who can work specifically with your conditions, or a yoga therapist, because I myself, as a yoga therapist, I love to collaborate with other wellness and healthcare practitioners and build a collaboration so that our patients and clients can get the best holistic care. You can also go to yogatherapy.health, which is a website to find local yoga therapists near you. When you are checking out yoga teachers and yoga therapists, seeing which one is the right one for you, you can consider going onto their website as well as their social media platforms. Most yoga teachers now have some sort of video or photos either on social media or even YouTube, and you can check them out and check to see if those videos or photos feel like it's something that feels accessible and safe for you. One of the most important aspects is to find a teacher who you resonate with, because that resonation will help you build trust and a relationship with your yoga teacher to create a better relationship and level of trust between you and your teacher. This ultimately means that you two can work more effectively together to help you manage and resolve your ailments. My second tip for you, if you have chronic pain and you would like to start a yoga practice, is to start small. And this is something that many of us forget because we tend to want to go back to the type of intensity and exercises and activity levels that we were before chronic pain. But oftentimes, and you might have experienced firsthand yourself, is that if you overpush your body, that you actually suffer the consequences for hours, days, and maybe even weeks afterwards. So my suggestion is to start really small, even 3 to 5 minutes. And there's a variety of yoga practices that you can start with. Of course, most often you see on social media or TV or photos that these yoga poses look like this big, elaborate, really complicated, advanced poses. But really, you can start with simple breathing practices to help you calm your nervous system down, even on your high pain days. With these kind of practices, you'll definitely want to find a yoga teacher who knows how to accommodate for your high and low pain days. Now, the other caveat is that on the low pain days, you're going to be tempted to do a lot more. But I would advise that you still keep within this smaller incremental step so that you don't overpush your boundaries. You want to kind of just go to the edge of your energy and your mobility boundaries and just slowly push that envelope a little bit at a time without crashing into pain. You can think of it as approaching a small, scared dog. You're not going to just go running at it because it's going to get frightened and run away. You're going to approach it very slowly, say assuring words and maybe pause and let it come to you for a few moments so that you start to develop trust and the dogs start to develop a sense of safety and nurturing from you. This is the same with your body. You don't want to go too fast, too quickly in, because with chronic pain, your physiological states have already been altered in a way that everything's just a little bit more on alert. So you want to go gentle, very nourishing, very reassuring along the way. So my second tip is to start small. If you like, you can check out some of my breathing practices here and also gentle movement practices here to help you get started with these incremental, smaller steps. My third tip for you to help you pursue a yoga practice that is right for you without suffering consequences is to stop whenever you need to. Now, in a class setting, it is harder for you to stop and walk out because you might feel kind of embarrassed or ashamed, or you don't want to make the teacher feel like they did something. But communicate with the teacher, and if you are seeking out a one-on-one yoga therapist or yoga teacher, they will know how to accommodate for your energy levels for that day. Ultimately, you know your body best and really do communicate with your yoga teacher. You want to keep your body as your utmost priority in keeping an equilibrium. My fourth tip for practicing yoga for chronic pain is to evaluate often and evaluate frequently. This is what I mean by evaluate. After each yoga practice, check in with yourself, see how you feel. Allow yourself plenty of time within your yoga practice, either between sides or between poses, to pause, to rest, and to evaluate. Take an inventory of what the effects of that pose were on you. And even if that same pose felt really good yesterday, it might be different today, and you want to be able to evaluate and observe that before moving on. If something doesn't feel like it's safe for you to do that day, it isn't wise for you to do that day, you have, by all means, back to step number 3, is to stop at any time. You will also want to evaluate and observe your body after every practice, whether that's a 5, 10, or a 30-minute practice, to see how that felt in you for your energy levels, for your mood, and in your pain levels. So here's a good approach. We're going to take 3 to 5 minute yoga practice as our benchmark. Let's say after the 3 to 5 minute practice, you pause, let yourself rest, and evaluate how that felt for you. Do you still feel energized? Do you feel a little fatigued and slightly challenged, but you feel like after a few minutes or about 20 minutes, you feel fairly recovered? Then that's a good indication that you're still working within your envelope and your safe boundaries. And next week, you can actually increase either the duration or the intensity of your yoga practice by about 10%. The reason I say next week is that we want to give an ample amount of time, enough days for your body to get used to that intensity and duration. Now, if on the flip side, after that 3 to 5 minutes, you felt like it was way too much, you feel exhausted for hours and maybe a couple days afterwards, then you want to scale back by about 10%, because that means that you probably have just pushed the envelope just a little bit too much and your body's kind of reacting to it. Remember, we want to try to keep the body in this nice equilibrium and pushing the envelope just a little bit at a time. So to summarize, go slowly, evaluate often and frequently. Now, my fifth and final tip for you is to have a plan A, a plan B, and perhaps even a plan C. So you'll want to have a plan A, say, for your high pain days. Perhaps you have a favorite practice, 3-minute practice, where it's more focused on breathing and something that you can do in bed while you are quite fatigued or are having a flare. You can also have a plan B for your low pain days when you're feeling rather good, and that practice can be a little longer, say 20 minutes or so, focusing more on mobility and strength. You can also have plan C, where it's kind of somewhere in between, where you have a combination of relaxation-based practices as well as gentle mobility, so that it's kind of this baseline practice that you have generally for most of your days. Again, this is something a yoga teacher or yoga therapist can work with you privately one-on-one to help you determine and create your own customized plan A, B, C, and so forth. You can also peruse my library of yoga videos. Many of them start from 3 to 5 minutes up to 40 minutes or so, and perhaps bookmark a few that feel right in your body in terms of the duration and intensity. Bookmark it for your low pain days, high pain days, and everything in between. The point is that you want to do a little bit of something every day, even if it feels incredibly hard to. Remember, you can even just do some breathing practices because these ancient techniques are designed to help to bring your systems back into balance to help de-escalate any agitation in your nervous system that sends your pain levels up. So a little bit something every day is the key. So here are my 5 tips again for practicing yoga when you have chronic pain without suffering the consequences. Finding the right teacher, starting small, stopping when needed, evaluating often, and having plans for high, low pain days as well as anything in between. My hopes is that you don't feel too defeated or disappointed after having a few bad experiences with yoga practices. And if you have any other questions, you can always email me at elaineyogatherapy@gmail.com. If you enjoyed this video, give it a thumbs up and subscribe to my channel for more pain care yoga strategies and practices to help you dial down pain.